सर सौरभ सर का माइक बंद करवाइए प्लीज. Hello everyone, good evening to all. I Dr. Saurabh Sharma, professor from Mahakal Institute of Pharmaceutical Studies, Ujjain, member team Pharmalok, welcomes to you in a 15 days faculty student development program FSDP 2025 organized by the Pharmalok, supported by the APTI Association of Pharmacy Teachers of India and Sri Balaji Book Distribution, Pharmatutor, Solution of Pharmacy, Rudraksh Book Private Limited, Bureau of Health Education Status Upliftment. In this 15 days national academic initiative is designed to empower the pharmacy fraternity through the high impact learning, advanced training, and a skill development across the education and the research and the professional practice. So this module is based on this type of basic parts of this 15 days student faculty development program. They are directly or deeply associated with the education, pharmaceutical education, research, and professional practices. So in the last 2 days, we have completed 2 sessions of Professor Rakesh Somani sir and Professor R.K. Khar sir. Today's session with the Professor Mahesh Chhabria sir, Principal, LM College of Pharmacy, Ahmedabad, Gujarat, on the topic of modern teaching pedagogies for pharmacy education, coverage, case-based learning, simulation teaching, digital tool, OSCE methodology, student-centered learning. So this topic is so related to the pedagogy because every teacher is know about the pedagogy. Because before the thinking of pedagogy, we are not able to teach any type of learning to the students. Okay, so today topic is basically on the pedagogy of the pharmaceutical field. So, then before starting this session, I briefly introduce Professor Chhabria sir biosketch. Sir, with your permission, I introduce your biosketch, sir. Dr. Mahesh Tikamal Chhabria is an academic qualification M.Pharm PhD FICS designation as a principal, institutional LM College of Pharmacy, Ahmedabad. LM College is a renowned and the oldest pharmacy college in the India because this foundation is founded by our father of pharmacy, M.L. Shraf sir. And I am a most thankful or I am most person then visit the LM College of Pharmacy. Then sir have a very good sound academic achievements in publications, original research articles, National 10, International 67, review published National 2, International 8, invited reviews to scientific presentation, International 20, National 65, Indian patent applied 60, published 28, granted 28. It's a huge amount of publication academic writing knowledge with us, sir. Total number of publication is Scopus Index is International Journal or UGC approved journal is 85. Research grant received 221 lakhs. Industrial research project completed 20 lakhs. Received a grant of rupees 8.36 crore for setting up Atal Incubation Center lab at LM College of Pharmacy from the Atal Innovation Mission, Niti Aayog, New Delhi. Received a grant of rupees 40 lakhs per year for 5 years from the state government under the Student Startup and Innovation Policy. Received rupees of 12.45 crore under CSR initiative for the industries. Research scholars supervised, sir have a M.Pharm student supervised, 140 M.Pharm students are supervised, working to number of PhD students supervised, completed 7 PhD scholars are completed their PhD under the supervision of Chhabria sir, working 7 students are there. Other academic achievement in academic related academic, sir have a fellow of Indian Chemical Society, fellow of Gujarat Science Academy, deliver more than 80 initiative lectures at a various scientific symposium and the program, organized many international, national and state level seminar and conferences, won several awards, research paper presentation and the Om Ashram Preeti Best Paper Award, SK Banerjee Memorial Oration Award, reviewer of 4 international scientific journal, review of international projects, Court Senate member of Gujarat University, listed Mercu, who has 2005, 2006, 2007, 2010, listed International Biography of the Sciences, life member of Ahmedabad Management Association, life member of Association of Pharmacy Teachers of India, member of Admission Committee of the Professional Courses Gujarat, nominated an Associate Dean Gujarat Technical University in 2 times, Senate member in Naipar Ahmedabad 3 years, for the 3 years, nominated as an expert member of a Board of Studies in Pharmacy and Faculty in MS University Baroda, member of a Board of Studies Gujarat Technical University, MS University Churusat, member of Advisory Committee Multidisciplinary International Conference GUTICON 2019, nominated a member of Pharmacy Board of AICT for the 3 years, nominated a member of Syllabus Revision Committee of Form D Course in Pharmacy Council in 2020, nominated a member of Syllabus Revision Committee MPharm courses in PCI 2020, nominated as a member of Academic Council of Gujarat Technical University for 3 years, nominated as a member of Academic Council of Gujarat Technical University and RC Patel Institute of Pharmacy, Shirpur, Maharashtra, and many more. So he has a huge professional sound knowledge and the sound experience with sir. So sir has completed a wonderful professional journey. So I request, I'm not taking so much time. I request to sir start the session and giving your views on the pharmaceutical pedagogy, sir.
Thank you very much, Dr. Saurabhji, for extensive introduction and kind words. Am I audible? Clear?
Yes, sir.
Okay. So at the outset, I'm very much thankful to Amitji, Dr. Saurabhji, and Team Pharmalok for giving me this opportunity to share my views or whatever the experience I have gained throughout the journey of my academic journey. Now, when we are talking about the pharma education, now we know that India is known as a hub of pharmacy for the world. And when it is so, obviously, pharma education has played a very important and pivotal role in making the India as a hub of pharmacy. Now that means what are the traditional knowledge which was imparted to the students, which was also a skilled based, competency based, and that has led the India to become or to sustain or to maintain, to remain as a pharmacy of the world. But with the old glory or with the old traditional methodology, we may not sustain in the near technology or in the modern era. Because we know that pharmacy is a technology intensive, and wherever the technology is involved, it remains dynamic. It changes very fast. So if we won't make up ourselves, or if we won't move with the technology, or won't transact the newer technology to the students, we won't match with the world technology. And obviously, for that, the teachers have to update and upgrade their knowledge, adapt the technology. It changes very fast, and transact that technologies or what newer happenings in the field to the students. When I discuss with the many faculties of the or the experts, or some of the faculties also says that no, sir, this is not in the syllabus. The university has not described this or prescribed this, or PCI has defined this syllabus only. So I want to say that, so whatever the syllabus is described or prescribed by the university or the PCI, in our case, it's always we follow the PCI. It's the minimum requirement. The minimum, the pharmacist, when it gets B Pharm or D Pharm, that pharmacist should know this much. Maximum, there is no limit. So it's up to us what kind of pharmacist we want to give to our country. You update your students with the modern or updated or upgraded knowledge. They should not feel that this is nothing, I don't know, this is new for me. So that modern pedagogies also we have to follow. Now we know well that, and we may have came across this sentence, now that teaching should be student-centric. Obviously it was there, student-centric, and now also it should be a student-centric also. Now when we are saying that it should be student-centric, obviously we should know the intellect or grasping of power of the student. All students are not of the same level. Some may be the fast learners, some may be intermediate, some may be slow learner, some may learn by simple hearing, some may learn by seeing it, some may learn by doing it. So keeping everything in this mind, so student is not, all students are not same. So if you wish to give the student centric, obviously we have to think or apply a different methodology for even a same kind of topic. And then all kind of students will gain the knowledge or learn whatever you wish to transact. So keeping this in mind, I have prepared few slides, and if possible, I'll also discuss one or two case studies also, where how we are transacting, say, some of the topics. My expertise is in medicinal chemistry, so obviously I'll discuss about the medicinal chemistry. But before going there, I wish to discuss about the some basics of what the teaching pedagogy is, traditional and modern one. Saurabhji is not showing the sharing of the PowerPoint.
Okay, Abhishek is here. Abhishek ji, please help to sir to share their screen on. Abhishek ji, yeah, okay.
Is it visible now? Okay.
Yes, sir.
Yeah, sorry. So I'm going to discuss about the modern teaching pedagogies for pharmacy education. And as I said, traditionally also we were transacting skill-based or the competency-based learning. But as I said, the technologies are changing. We have to adapt and move ahead. So this is about what the traditional India is evolved from the traditional lectures to the competency-based learning and limitation of the traditional methods. Obviously, the didactic lectures, earlier the instructor was delivering the content and student passively received it. There was no interaction. So just whatever has been transacted, student has to learn. So it was passive learning. There was no critical thinking or clinical decision making involved from the student side. And so the student engagement was very low. Now, why we need the modern pedagogies? Now, this innovation in the pedagogy is needed to expand because we know now the pharmacist role has expanded. It has shifted from product focus to the patient-centered care. And we know that the complexity of the therapeutics has also increased. And now we wish, if we consider the pharmacies as a very important part of the healthcare system, so along with the medical professionals, obviously the pharmacist also has to play a very important role in clinical decisions also. Now let me discuss about what the India has, as I said, the India has reached up to the level that where India is a very well known as a pharmacy of the world. But there is a but. India is a pharmacy of the world in providing the pharmaceuticals. So India has done a really exceedingly well in industrial pharmacy. But if we talk about the patient care, the clinical pharmacy, hospital pharmacy, community pharmacy, it has to do a lot. And India has started in moving in that direction. And surely we will achieve and will reach there. So there, pharmacists will play a very, very important role. And there, pharmacist has to learn how can I be a very good hospital pharmacist? How can I be a very good community pharmacist, clinical pharmacist? Now, why we need this pedagogical innovation? Next point is technological advancements. If you see, I can list a long, give it a long list where the technologies have changed a lot. Simple thing, if I say the drug discovery from say, disease identification to the product reaches up to the pharmacy itself. Various or many steps are involved in. And at each and every steps, pharmacists play a very important role. And for each and every steps, technologies are very dynamic, very dynamic. If I say for the simply a drug designing, earlier the traditional method was there. Now we are talking about the computer-aided drug designing. Variety in that also, variety of methodologies are there, structure-based, ligand-based. Under that also many methods are there. So that advancements are there. If I don't adopt this, I cannot translate that to the students. So that is very important. Now the emphasis is given to the patient-centered care. Even we are talking about the personalized medicine also. We'll discuss about that in the next slide. Outcome-based education models. We were doing good in education, transacting good education. Now everything is to be on a paper, formalized. Everything has to be done. Outcome, course outcome, program outcome, then mapping, and then defined as outcome-based education. Various models, I think even Dr. Kerr, Professor Kerr sir has also already discussed about that yesterday. Nowadays, the demand is practice-ready graduates. Now they need industry-ready graduates. So there you have to make your pharmacy graduate competency ready, a competent pharmacist. Even globally, they are asking about, or they are expecting a competency-based education or the pharmacist. Along with this, now it's the era of digital and the AI and machine learning. So that integration of the digital health tools in pharmacy practice is also there. So we have to learn and that pass on to the students. Research competence, very important. As I said, in the drug discovery, from the disease to the drug reaches of the pharmacy itself, various stages are there. And at each stage, research plays a very important role. So even you have to pass on this, what the research methodology means, how you can do the research, that you should pass on straight away at the B Farm level also. Leadership quality. When I'm saying drug discovery, from disease identification to the pharmacy itself, it is a teamwork. It is not the work or job of only one person. So in that team, someone has to lead that team. That leadership quality has also to be generated or is to be inculcated into the students. And moreover, interprofessional collaborations with the industry, with academics, with other institute, national level institute, international level institute, international level industries. Or that collaborations are very, very important, and that will help not only to the person who are doing so, but to the institute and to the students also. That will change the atmosphere, the vibrations in your institute. Now, this various approaches are there in modern pedagogical pedagogies. First is active learning, flipped classroom. Means you give the topic to the student and tell them you learn or you go through the theory at home, and during the class time you discuss, have the student discussion, and teach them how you can apply this knowledge which you have gained. So application-based knowledge will help them a lot. And that will enhance the retention of that student in the class, focusing on the class, what you are teaching, and also differently thinking, critical thinking. Problem-based learning, give problem to the students. Real-world clinical cases or industrial-based problems of anything. It is to be of a formulation or analysis or chemistry based. Any problem it is there. If you are getting a small problem in the industry, give that problem to the students. Tell them to discuss about, or you give them a case studies already which have already been solved. Give them that cases. Tell them how you can solve it, and teach them how it was solved, so that you can match. Or they may come out with something different also. And that will be very, very good. That you can publish also. So encourages the teamwork and analytical reasoning. When you give them a project, make a team. in the team they can discuss and come out with a different solution also. Case-based study till today also we are doing so. So structure cases mirroring, pharmacy practice scenario. This is about the pharmacy practice. Even case study based you can do for all specializations also. And team-based learning, this is very good. As I said, the students are of different level, fast learner, slow learner, or mediocre or intermediate level learner. If you make a team of all three, you put one or two fast learners, two slow learners, and five slow learners and two intermediate learners, and tell them to discuss something. Even it may happen that slow learner may get the things very fast when they are discussing peers. So that will surely help. And team-based collaborations also will be very useful. The technology enhanced learning management system. This is about even faculties, not only the students. As I said, faculty should also get updated and upgraded. So learning management system, you can use the courses, various courses through Moodle or Canvas. Many others are there. Virtual labs and the simulations. And this virtual labs and simulation, you are simulating what is there actual. This is you are doing not actual on computer or on the any other in silico based methodology. So it is safe. It can repeated. Suppose once you are doing that, if you're not understanding, you repeat the same thing. And that independent learning can also happen in that. If students do that at home, using the virtual lab or the simulation, he or she can. For the pharmacy practice, virtual patients, even for the, as I said, the drug discovery, virtual screening, artificial intelligence and the adaptive learning, personalized learning paths are also there. Mobile learning, as I said, the digital era is there. The things earlier, what we were doing in the earlier phase of the drug discovery, a huge silicon graphics based workstations were required for designing. Now you can do it in your simple PC also. And the same thing, many things which you can, earlier it was thought that you can do it in a PC only. You can do it now in using mobile app also. So app for the databases, flashcards, quizzes can also be taken in the mobile learning. Simulation-based pedagogies, the human patient simulator for clinical training is very useful. Useful for the emergency response also. Dosing errors, counseling, which is known as high fidelity simulation. Then objective structured clinical examination. Now this is a modern examination format where the student rotate through a series of stations, which involves history taking, physical examination, counseling, and the technical procedures. This is specifically for the clinical or the pharmacy practice students. And assessment of the real-time communication and clinical skills are developed through this kind of examination. E-learning and the learning management system, this is for the even students and, as I said, for the teachers also. Moodle, Canvas, Blackboard for module and the assessment. Then AI assisted learning, decision support tools, quizzes, virtual mentors, artificial intelligence assisted, all these things are available. Now, one thing is there, one thing I want to clear with all the faculty members also, that you might be worrying about that if AI is there, that AI will take over all what we teachers are doing. No, it won't. Rather, don't force students not to use AI tools. Rather, you teach them how to use the AI tools correctly. Tell them to get, get this topic from the AI using AI. Tell that person or the student to go through this, whatever the output is there, in detail, understand it, and write it in your language. That will help students. You be there with him or her, discuss with whatever, wherever he is not able to learn or clarify the topic, and there your involvement or HI of the faculty, human intelligence, will always help them, and they need that. Next is the gamification, very important for the student. If they learn by playing games, they will learn faster. So that kind of things are also coming up, and you may find more in coming days also. The digital tools for the pharmacy practice, specifically for e-prescription, drug interaction, chalkers, virtual dispensing softwares, these are very important, and we should update with all this and transact it to the students also. Interprofessional education, the collaborative learning. Now, when we are the part of the healthcare system, and we know who are there in the healthcare system, so we have to work in tandem with them. We have to collaborate with them. We have to take problems or issues from them also and help them to solve how we can solve. So collaborative learning with medical, nursing, and allied healthcare students, enhancing the communication, teamwork, and the patient-centered care, and encourage understanding of pharmacist's role in the healthcare team is very important, and that is the interprofessional education is important. This is very important. As I said, when you integrate the research component in your teaching, then your class will become a very vibrant. Students will participate, whatever you do, they will interact with you. Even student interaction within them will also increase. And that's very much important. So for that, obviously, you expose the student early for the research methodology. As I mentioned, even in the BPharm level, you can give them a mini projects. Now in the BPharm level, SEM 7, SEM 8, we are doing the practice school and the project work. There you give them a mini project work. At our institute, we give them an innovation, the project where the innovations are involved. Very small, that they can finish it within the 6 months. They find out the problems from the society, healthcare related problem, even other problems. And mentoring should be given from the faculties always, obviously, and help them to solve that problem. They do it very interestingly, getting involved in that. Encourage the evidence-based practices and development of the scientific writing. Obviously, in the practice school, we focus on the review articles. So ask them to write. As I said, when you ask them to write a review article, they are going to use ChatGPT. No problem. Tell them to use ChatGPT, but read it and write it in your language. I don't want a plagiarism more than say 2 to 3%. Then they will always think how to write. They will learn scientific writing and for the critical appraisal also to give mention the names who have earlier done that work. Competency-based pharmaceutical education. What kind of competencies are required or achieving the clearly competencies in clinical competence, ethical decision making. Now, word ethical here is very, very important. When I'm saying we are the important part of healthcare system. Now you are dealing with the health of patient. Now when you are dealing with the patient, if anywhere ethics are compromised, you are not dealing with the health of only one patient, it may be 100, thousands or more. So to the student, the teachers have to teach them the highest level of ethics. Wherever, whatever they do, in whatever field they are, even at the retail pharmacy level, they should be having a ethics of highest level. Leadership and management, obviously through that, as I said, that when projects are done, tell them to be in a group and see who leading the team. Help him to be a leader of the future. And there the combination skills also of the student improves. Assessment based on the skill mastery rather than the time based learning. Whenever we are assessing any students, you assess that student based on skill gained by that student, not by the time spent by the student for that particular skill, gaining that skill. So that is to be taken care of to differentiate the even students' competency also. Assessment innovations, obviously, when modern pedagogies we are talking about, if all other things are modernized, your assessment should also be different. So objective structure clinical examination, we already discussed about. Peers and the self-assessment, ask student to assess yourself and then come to me or come to the teacher. Or ask that student, or you interchange the assessment. You give one student's answer sheet to the other and tell them to assess. That will always help them to critically examine, observe, check that is there any mistake or not. That will help him in a future also to the students. The assessment innovation, obviously it involves continuous formative assessment, portfolio-based evaluation, what work that student has done across that semester in that particular subject. Now what we call it as the journals. So that whether the student has gained that knowledge or he has written or she has written only the written or copied from the other. That has to be also taken care of. Rubric driven, you define the criteria for feedback also and assess based on that. Simulation based assessment. And now even in the future you may find the AI based assessment also. The peer and the self-evaluation tools can also be used for assessing the student. This is for the faculty. As I said, faculty has to update and upgrade themselves. So faculty development is very important. And here I give compliment to the Pharmacolog team and Amit ji also, that they have come up with this student and faculty development. It is very rare. And surely compliments and congratulations to them for taking out or coming up with this kind of faculty development program. This will surely help to the students and faculty members also. Now, faculty development, it should not be the faculty development of the 15 days only. Faculty is lifelong learner. The teacher who stops learning, I don't want to use that word, it should stop then teaching also. Because You are hoping the future of the future pharmacist. So continuously update and upgrade yourself and transact that knowledge. So it should be continuous training in pedagogy and technology, mentorship program they should attend, research in educational method are also very important for all the faculties, soft skills and professionalism training, communication and counseling, empathy and patient engagement, leadership and the team management, cultural competency. This is very important. I would say this soft skill and professional training for the faculty as well as for the students also. And again, I am repeating professional ethics and integrity. Actually, I am mistaken that this should be at the top. Always have that yourself also as a faculty and teach that to the students also. This is also very important. Industrial collaboration and experiential learning, internship, clerkship. This we are doing as a part of our curriculum. Industrial project handling. This is very important. As I said, the small project from the industry, if you give it to the students, that will be the lifelong learning for the students. That group, they will learn many things. Their professional development, their personality development will be there. The industrial visits and the industrial training, workshop by the pharmaceutical companies in collaboration, you can do that. And real world exposure to regulatory, manufacturing, and clinical trials. These are very important. When you have this kind of collaborations, you can pass on this kind of exposure to the students also. I mean, if we talk about the future perspective, integration of AI and machine learning, we know well, it's already started in the curricular design. Even PCI has also included this AI and machine learning in all subjects, which is very, very important. And I compliment even PCI for this. All the students, now for that, having that topic in the curriculum doesn't mean we have transacted that knowledge to the student. All the faculty has to be updated and upgraded with this. Then and then you will be able to. Personalized learning with the AI, and AI is there, even faculty or the student can do the personalized learning. Tailored learning pathways, AI-driven performance analytics can also be done. As I said, the assessment can also, AI can do that assessment. Integration of the digital health and telepharmacy, we know well, is already there. The training in teleconsultation and remote patient monitoring. You can initiate 30 hours or 60 hours small certificate courses also for the students to have this kind of exposure. Expansion of the pharmacist role is already there. Pharmacogenomics, chronic disease management, public health, and the preventive care. Now, when pharmacists know about the pharmacogenomics, some chronic diseases are also there. But simple example, if I give, the tuberculosis is always a challenge, health challenge rather, I would say, as far as our country is also concerned. Now, when one person with 80 kg getting the treatment of the TB with one dose of say rifampicin and INH, and the other person of the 40 kg will get the same dose, then obviously the person with the 40 kg will surely show a very serious side effects, and he or she might stop taking drug at any time, and we may see the resistance later on. Even though not only the weight, the person to person, the genetic structure is different. And that's why the biometric is successful. So when gene structures are different, obviously the enzyme level will also be different. So different level, the different dose will be required by the different patients or two patients. The patients with a higher level of enzyme metabolize, and the level of that drug will be there in the for the killing the mycobacteria. So when low level is there, that may lead to the resistance again. So there, pharmacist's role is very, very important. The global harmonization of the pharmacy education, always, obviously, whatever the good things are there in other countries, that has to be adopted and implemented for the benefit of the society here in our country also. So international competency framework, mobility programs, and the global internships can also help. Global virtual classrooms. Obviously, we are organizing, or many institutes are organizing international conferences, seminars. There they can share there what they are doing and can be of use for us also. Emphasis on the entrepreneurship and innovation. Again, very, very important. Ask them to be a job creator, not always a job seeker. Newer ideas, innovation, if you start with the beginning, you all know well, the MHRD has also approved the IICs, Institutional Innovation Councils. State level innovative programs are there, programs are there for innovation and support, finance support. And then the incubation centers are there. If all three are there in your institute, we have it at our institute. If all three are there, motivate, inspire students for the innovation. And they may come up with the startups. And that will give some name, added edge to your, not only the student, to your institute also. The sustainability and ethics in pharmaceutical education. What is that? The teaching students about the eco-friendly drug manufacturing, waste reduction, very important. The last important point is safe disposal of pharmaceuticals. Even the environment is polluted. Many examples are there. So we have to be very, very careful. And at some points of time, we are worried about when these antibiotics are disposed like this, that may lead to the AMR. And that will be a very, very dangerous for all the human beings. So what are the challenges ahead? Obviously, resistance to change. If we are not ready to change, then time won't wait for you. It will evolve, it will change, and you will find you are out of the track. So don't resist, adapt, update, and upgrade yourself. Faculty training and upskilling is always very important. Infrastructure and training gaps are there. Yes, that points are there. But as I said, where there are challenges. Even I am saying the same thing to my students also. We always complain about the healthcare system in our country because we are thickly populated country. There are challenges in our healthcare system. The Sustainable Development Goals also ask about do that. And we are fortunate as a pharmacist, we can adapt the 3 sustainable goals at a time in our, as being a pharmacy educationist. So I said I always mention to my students, when there are challenges, there are opportunities. Convert that challenges into opportunities, come out with the solutions, and that solution may lead to the startup for you, a new product you may come out, and that will always be useful to the society. Next is balancing technology with the human interaction, balancing theoretical and the practical components. Always it should be there. And the balancing in a way that whatever that you are teaching in the theory, you should map that with in the practical classes also. Even though if it is not there in the syllabus, if it is there in the theory, you show them, you teach them, demonstrate them, or ask them to do it in the practical class also. Ensure students' engagement in a digital environment. Students that get involved in whatever you do. And you should have the standardized assessment framework. So in short, in conclusion, I'd say the modern pedagogies empower pharmacy graduates to become highly skilled, adaptable healthcare professionals. Integration of technology, active learning, and competency-based methods ensures practice readiness, and future pharmacy education will be student-centered, increasingly digital, personalized, and globally harmonized. This is all from my side, and I would say all the teachers, anyone when the students are there, you should update and upgrade always. Be ready to adapt the changes, be ready to get the knowledge. That will help you a lot in your profession and whatever you do. Thank you. Thank you very much.
Thank you, sir. Such a wonderful session, and you can clear so much of doubt related to the teaching and pedagogies related problems facing in the current time. Because this time is a student behavior and the mentality totally changed. And that time the chalkboard system is there, but the students are not interested to learn by the chalkboard system. They are learned by the websites, they are learned by the mobile phones, they are learned by the YouTubes. So it's a challenging time for the teacher, sir. So there is a wonderful explanation all the topics related to the technology enhancement learning, related to modern pedagogy approaches, related to technology integrated teaching, professional education, research integrated pedagogy, competency based pharmacy education. You can wonderfully explain with the related to the examples, sir. So I ask to anyone ask us a question related to this presentation, can easy to write your question in the chat box. Anyone ask to any question related to this topic, write in a chat box. Some Mr. Shweta Kulkarni, sir, learning Python is a challenging. Kindly guide, sir, because the AIML is based on the Python language. So how a pharmacy teacher can learn the Python easily? In YouTube, we are saying a 13, 14, 15 lectures available for the Python learning. But in pharmaceutical teachers, it is so much a tedious task to learn the Python, sir. So please guide the sir.
It is there, obviously. Most of the AI that based on the Python only. Rather, I would say, even when you are going through the YouTube or anything, you go through that, no problem. But if any computer engineering college or any institute is there nearby to your institute, I would suggest you to connect that institute. Whosoever the teacher is there, discuss with the teacher, ask that teacher to take expert lectures or sessions at your institute. collaborate with them also. As I say, the collaboration is very important. Nowadays, I won't say that I can do only everything and anything and everything. No. So if such things are there, obviously collaborate with the technical institute, the computer science institute. Tell them or ask them to teach you or take the sessions or the Python. The things will become very easy because in the YouTube you cannot solve your issues, your problems, or what are the questions you have, the queries you have. But this kind of the personalized involvement will surely solve your question and queries, and you may get interest in the Python.
Thank you, sir. I think that Shweta ma'am question you satisfy the answer with the sir. Sir, it's a one my question my side, sir. Sir, there are so many difficulties in related to practical approach to learn to the various software related problems is there to in a medium level institute we are not able to learn the software and not able to learn the simulations of different subjects. So how to teach a student to easily learn about the softwares and the simulation of the different subjects?
See, very important, as I said, the teacher has to learn. Teacher has to update and upgrade themselves. They have to be very clear. The shallow learning won't help. You should be expert in that first. और हिंदी में शायद कहावत है, कुएं में होगा तो खेत में आएगा, ऐसा है. तो अगर वो लर्निंग प्रॉपर होगी तो जब भी आप स्टूडेंट को पढ़ाते हैं या जब भी आप ट्रांसैक्ट करते हो, बता रहे हो, तो आप अथॉरिटी के साथ ही कहोगे क्योंकि बिकॉज यू नो. और वो कॉन्फिडेंस और वो जिससे आप बात करोगे स्टूडेंट से, तो स्टूडेंट के पास भी लर्निंग काफी इजीली होगी. एंड देन whatever the software you are using, ask student to use it, practically do it. That will surely help them student to clarify everything. So that is very important. For many things, many free softwares are available. Some institute who afford this, they get the license of the software and that becomes easy. Again, for that, if any institute nearby having this license, if you collaborate with that institute, I want to collaborate for this. You give something from your side also. That collaboration will also be useful for using the facilities there. So such thing will come with the experience and expertise. And then you will be able to transact correctly to the students. And student will have the interest in whatever you to teach. Your mic is off, Dr. Saurabh ji.
Okay. Sir, thank you, sir, for giving us such a wonderful suggestion to our future teachers, future students to learning this type of collaboration approaches because the सबके पास सब कुछ चीजें नहीं हो सकती सर. तो वही कॉन्सेप्ट पे हमें काम करना चाहिए. तो डेफिनेटली सर वी कैन अचीव आवर गोल्स.
मैं एक बात ये भी कहूंगा कि ये तो अभी आई है, हम इंडियन जो हमारा जो इंटेलेक्ट है,
हाँ जी सर,
वो दूसरों के कंपैरिजन में बहुत बहुत अच्छी है
जी.
और द सेम थिंग वी कैन यूज और वी कैन टीच द स्टूडेंट डिफरेंटली. द स्टूडेंट विल अडॉप्ट और स्टूडेंट विल अंडरस्टैंड दैट वेरी इजीली. द सिंपल वॉट एवर आपके समाज के आसपास जो भी चीजें बन रही है, आप वो चीजों के साथ अब कोरिलेट करेंगे तो स्टूडेंट वो चीज लाइफ लॉन्ग अपने लिए लर्न करके रखेगा, वो दिमाग में रहेगा उसके. सिंपल एग्जांपल अगर दूं, जो अगर ऑर्गेनिक केमिस्ट के टीचर्स या स्टूडेंट्स हैं उनके लिए इजी रहेगा वो, कि मैं अगर बच्चों को कार्बोकेटायन और कार्बन फ्री रेडिकल की स्टेबिलिटी के बारे में पढ़ाना चाहता हूं, अगर मैं स्ट्रेट अवे कहूंगा कि नहीं tertiary is more stable than secondary, then primary, and then methyl. तो बच्चा चाहे रट्टा मारेगा या तो कुछ भी बोलेगा या उसको समझ नहीं पाएगा या बोलेगा ये है बस. लेकिन क्यों स्टेबल है? अगर उसके वो प्रिंसिपल उनको पढ़ाता है तो मैंने क्या किया, वो मैंने एक्चुअली वो पेपर इंटरनेशनल जर्नल में पब्लिश भी किया है. कार्बन फादर एंड हिज 4 चिल्ड्रन. कार्बन इज अ फादर एंड 4 हाइड्रोजन आर हिज चिल्ड्रन. अभी हैप्पी फैमिली है, इंडियन के लिए बहुत कोरिलेट करता है, क्योंकि फॉरेन में हम नहीं बोल सकते कि भाई कंबाइंड फैमिली, जॉइंट फैमिली होती है. तो यहाँ जॉइंट फैमिली का हमने लगाया, मैंने उसमें लगाया है. जॉइंट फैमिली अच्छी है, हैप्पी हेल्दी है. उसके बाद बच्चे थोड़े बड़े होते हैं तो थोड़ा डिस्प्यूट आया फैमिली में, तो एक बच्चा वो सेपरेट होना चाहता है फैमिली से, एक हाइड्रोजन. उसके बाद 2 ऑप्शन है, या तो फादर के भी इलेक्ट्रॉन लेके जाएगा या अपना इलेक्ट्रॉन बोले, फादर को बोलेगा कि नहीं अपना इलेक्ट्रॉन अपने पास रखो, मैं अपना इलेक्ट्रॉन लेके निकल रहा हूं. अगर फादर का इलेक्ट्रॉन भी लेके जा रहा है तो फादर को पास पॉजिटिव चार्ज आ जाएगा, और अपना इलेक्ट्रॉन लेके जाता है तो फ्री रेडिकल बन जाएगा. दोनों केस में फादर डिस्टेबिलाइज हो जाएंगे, ऑक्टेट उसका कंप्लीट नहीं हो रहा है और स्टेबिलिटी नहीं मिल रही है. तो मिथाइल इज अ लीस्ट स्टेबल. अभी अगर एक बच्चा मिथाइल है, थोड़ा हेल्दी है, हाइड्रोजन हेल्दी नहीं है, एक ही इलेक्ट्रॉन है, मिथाइल ग्रुप है, हेल्दी है, वो क्या करेगा, फादर को इलेक्ट्रॉन डोनेट करेगा तो कुछ स्टेबिलिटी देगा, क्योंकि इलेक्ट्रॉन दे रहा है तो पॉजिटिविटी को वो थोड़ा न्यूट्रलाइज करेगा, तो इथाइल ग्रुप मोर स्टेबल बनेगा. अगर 2 बच्चे हेल्दी है, 2 मिथाइल ग्रुप है सेकेंडरी, तो और स्टेबिलिटी होगा. 3 बच्चे मिथाइल है टर्शरी, तो ऐसा बहुत डिटेल में उसको. तो ये मैंने एग्जांपल दिया. आप किसी भी चीज को इस तरह से अगर आप पूरा ऑर्गेनिक केमिस्ट्री देखने जाओ, उनकी रिएक्शन देखने जाओ, तो इधर जो भी रिएक्शन है वो एक कंपोनेंट जो इलेक्ट्रॉन देता है, दूसरा इलेक्ट्रॉन लेता है. रिएक्शन ऐसे बनता है ट्रांजिशन स्टेज में, राइट. तो आप देखने जाओगे तो पूरी रिएक्शन, मेजॉरिटी ऑफ द रिएक्शन यू विल फाइंड एसिड बेस रिएक्शन. तो उस तरह से अगर बच्चों को सिखाया जाए तो उनके लिए इजी बनता जाएगा. ये सिंपल एग्जांपल देता हूँ, ऐसा कुछ बहुत कुछ कर सकते हैं. तो ये इनोवेटिव टीचर्स को भी बनना पड़ेगा.
डेफिनेटली सर, इस लेवल पर हम आज तक कभी सोच नहीं पाए. इतनी छोटी सी चीज है और भारतीय समाज में देखने को हर दूसरे तीसरे घर में देखने को मिल रही है. लेकिन इस तरीके से केमिस्ट्री को, ऑर्गेनिक केमिस्ट्री को रिलेट करेंगे तो मैं भी एक वीकर स्टूडेंट रहा हूँ ऑर्गेनिक केमिस्ट्री में, लेकिन आज इस कॉन्सेप्ट को देखता हूँ तो केमिस्ट्री बहुत अच्छी लगने लगी मुझको. अभी से विजुअलाइजेशन करें अपन तो, अरे ये तो बहुत सरल है. डेफिनेटली सर, आप जैसे सीनियर गुरुजनों के अगर हम साथ बैठेंगे और इस तरीके के सेशन में हम डिस्कशन करेंगे तो डेफिनेटली हम भी उसके लिए फ्रूटफुल रहेगा हमारे लिए, और आने वाली जनरेशन और स्टूडेंट्स के लिए भी फ्रूटफुल रहेगा. तो थैंक यू सर for giving us such a wonderful session and giving us such a valuable time with us, sir. Thank you, sir.
Thank
on
you.
the behalf of Pharmalok team, I, Dr. Saurabh Sharma, thank you to you. And this is our certificate of appreciation for the today's lecture, sir. So taking this certificate, sir.
Thanks to you. Thanks to Amit ji, and thanks to all Pharmalok team and all the participants. Thank you very much for patient hearing. Thank you very much.
Thank you, sir.